Welcome to Middle Class Matters, Business News in English from Dr CMA Alagesan on CAG Audit Report 11 of 2023, Pradhan Mantri Jan Arogya Yojana PMJAY, Part number 18 continued. 7.5.2 Grievance Redressal at State and Union Territories. Audit noted that SHA Chhattisgarh has not redressed any of the 40 grievances received in 6 states and union territories: Andhra Pradesh, Assam, Chandigarh, Nagaland, Punjab, and Uttarakhand. Status of grievances redressal is as follows. Data related to the redressal of grievances within TAT and beyond TAT was not provided by 9 states and union territories. Dadar and Haveli, Gujarat, Himachal Pradesh, Jharkhand, Kerala, Madhya Pradesh, Meghalaya, Tamil Nadu, and Tripura. NHA, while accepting the audit observation, replied in August 2022 that the grievance redressal has been streamlined and state-specific guidelines has been issued to avoid the same. 7.6 Nodal officer for resolving of grievances at district level not appointed. Para 5.4 of Grievances Redressal Guidelines provide that District Grievance Nodal Officer DGNO is a person who is nominated by SGRC to resolve the grievances at district level, while the State Grievance Nodal Officer SGNO is nominated by SHA to address the grievances at the state level under PMJAY. Audit noted that in Andaman, Nodal Officer has not been appointed. NHA, while accepting the audit observation, replied in August 2022 that with the advancement in the implementation of this scheme, the states and union territories started the process of establishing the institutional framework for grievance redressal in the form of appointing DGNOs and SGNOs. 7.7 Formation of anti-fraud cells and other committees at the state level. PMJAY is governed by a zero-tolerance approach to any kind of fraud under the watchful supervision of NHA. PMJAY is aimed at assisting state governments in designing and managing a robust anti-fraud system in PMJAY. The scope of anti-fraud guidelines covers prevention, detection, and deterrence of different kinds of fraud that could occur in PMJAY at different stages of its implementation. Fraud management approaches, stages of implementation. Prevention: beneficiary identification and verification, provider enablement, pre-authorization, deduction, claims management, monitoring, audits. Deterrence: contract management, enforcement of contractual provisions. The National Anti-Fraud Unit (NAFU) has been set up for implementing the anti-fraud and abuse control framework and monitoring performance with the support of state anti-fraud units SAFU created at the state level. Anti-fraud guidelines set out the mechanisms for fraud management and lay down the legal framework, institutional arrangement, and capacity that will be necessary for implementing effective anti-fraud efforts. As per the anti-fraud guidelines, SHA shall be responsible for developing institutional structure and operationalizing dedicated anti-fraud cells, Claim Review Committee (CRC) and Mortality and Morbidity Review Committee (MMRC). Audit noted that anti-fraud cell in 4 states and union territories, CRC in 8 states and union territories, and MMRC in 11 states and union territories were not formed. Formation and committees: Andaman and Nicobar Anti-Fraud Cell CRC and MMRC not formed. Dadar and Diu CRC not formed. Himachal Pradesh CRC and MMRC not formed. Jammu and Kashmir Anti-Fraud Cell and MMRC not formed. Ladakh Anti-Fraud Cell CRC and MMRC not formed. Maharashtra MMRC not formed. Manipur CRC and MMRC not formed. Meghalaya CRC and MMRC not formed. Nagaland MMRC not formed. Punjab CRC and MMRC not formed. Puducherry Anti-Fraud Cell not formed. Rajasthan MMRC not formed. Tripura CRC and MMRC not formed. NHA, while accepting the audit observation, replied in August 2022 that NAFU has been issuing directives and reminders to all the states through anti-fraud guidelines and also various advisories regarding implementation of all anti-fraud guidelines. Due to non-constitution of required committees, the fraud cases communicated to NHA, death audit, claim audit and other activities may be hampered. 7.8 Non-conducting of anti-fraud awareness activities. As per para 3.2.5 of anti-fraud guidelines, it is the responsibility of SHA to design and implement strategies for beneficiary awareness on possible episodes of fraud under the PMJAY. The awareness may include understanding types of fraud, its impact on beneficiaries, preventive measures that the beneficiaries could take, and whom to report to. It may be done by using mass media or interpersonal communication at the point of service. Audit noted that 3 states or union territories, Bihar, Chandigarh and Uttar Pradesh, did not plan or conduct anti-fraud awareness activities. The documentary evidence regarding organizing of camps for fraud awareness were not made available to audit in any of the selected districts of Himachal Pradesh. Thus, the aim of apprising the beneficiaries of the possible irregularities in implementation of the program remained unachieved. NHA, while accepting the audit observation, replied in August 2022 that innovative measures have been taken for improving efficiency awareness regarding fraud and abuse. 7.9 Fraud cases. 7.9.1 No action taken on defaulters. Audit noted that 12 hospitals in Jharkhand and 1 hospital in Assam indulged in various malpractices, illegal collection of money from beneficiaries, repeated submission of same photograph for multiple claims, non-disclosure of facts, etc. However, follow-up action like recovery of amount of money collected and imposition of penalty, action against errant medical and paramedical professionals, de-empanelment of hospitals, etc. had not been initiated. NHA replied in August 2022 that SHA Jharkhand had taken appropriate action against the defaulters but did not furnish any documentary evidence in support of action taken. The reply in respect of SHA Assam was awaited. 7.10 Non-adoption of whistleblower policy. National Health Authority issued the PMJAY whistleblower policy as a step towards strengthening transparency and accountability in the implementation of PMJAY. The primary objective of the policy was to establish a mechanism to receive complaints relating to disclosure on any allegation of corruption, medical and non-medical fraud, etc. against any stakeholder involved with the implementation of PMJAY and to inquire or cause an inquiry into such disclosure and to provide adequate safeguards against victimization of the person making such complaint and for matters connected therewith and incidental thereto. Audit noted that 7 union territories and states Andaman Nicobar, Bihar, Chhattisgarh, Madhya Pradesh, Punjab, Rajasthan and Tamil Nadu had not adopted the whistleblower policy. Due to the non-adoption of the policy, the stakeholders involved in the scheme were deprived of the mechanism for complaining regarding cases of corruption, medical and non-medical frauds, etc. NHA, while accepting the audit observation, replied in August 2022 that states would be pursued to constitute these committees at the earliest and necessary directions would be issued for the implementation of whistleblower policy within the defined timeline. 7.11 Shortfall in conduct of medical and other social audit by ISA and SHA. Para 5.2.8 of Anti-Fraud Guidelines stipulates minimum sample for audit to minimize fraud prospects. Details of various types of audit to be conducted by the implementing state agency ISA and SHA and minimum sample for audit by ISA and SHA for each type of audit is given. Audit noted that NHA had not properly monitored the various types of audit conducted by the ISA and SHA in states. NHA only had information regarding medical audit conducted by SHA, while the information or data in respect of other types of audit was not available with NHA except for the state of Nagaland and Tripura. Deficiency in medical audits conducted by SHAs defeated the very purpose of implementing anti-fraud investigation on audit system to detect, prevent and deter fraud losses under PMJAY. Audit further noted that in two states, Nagaland and Tripura, there was heavy shortfall in conducting various types of audit. Shortcomings in states and union territories. Serial number 1, Andhra Pradesh. No medical and death audits were conducted by SHA in 48 sampled hospitals. 2, Bihar. Documents regarding medical audit in respect of mortality cases were not provided by Bihar Swasthata Suraksha Samiti. Moreover, separate committee for a high value pre-authorization requests had also not been constituted to monitor the pre-authorization activities and claim payment. Chandigarh. Neither any annual audit plan was prepared nor any document in support of the cases audited were found on record. Chhattisgarh. ISA appointed for the hospital audit conducted only 176 hospital audits against target of 1692 hospitals during January 2020 to July 2021. Dadar and Nagar. Audit reports related to medical hospital claim summary reports were not being submitted by the insurance company, which showed lack of internal control or monitoring over insurance company claims by UTHA. Haryana. 767 cases of mortality had been audited against the total mortality cases of 1022, which is 75% as prescribed 100%. Himachal Pradesh, shortfall ranging from 21 to 86% in conducting medical audit by ISA in 23 selected EHCPs had been noted. 8. Jammu and Kashmir. 1. Though SHA provided the number of audit conducted, no details on audit date, name of the auditor was provided. No audit in respect of certain audits, that is beneficiary audit, post-discharge through home visit, pre-authorization audit, claims audit, approved claims and beneficiary audit during hospitalization was conducted by SHA from December 2018 to December 2020 and beneficiary audit post-discharge through telephone from December 2018 to February 2022. In 112 cases, the dates of hospital audit were shown from admission of patients, and in 3,404 cases, the date of hospital audit was shown after the discharge of patient, which clearly indicates that fake audit reports were submitted by insurer and accepted by SHA Jammu and Kashmir. 9. Jharkhand. Out of deaths of 4,352 patients, only 563 death audit, 13% against the prescribed 100%, had been conducted by the agency engaged by SHA. 10. Karnataka. There was a shortfall of 19% in conduct of medical audit, 60,773 medical audit against the target of 75,083. Further, SHA had not conducted any beneficiary audit during hospitalization and post-discharge through home visits and claim audit of the rejected claims. 11. Kerala. SHA had not conducted any medical audit, death audit, beneficiary audit, post-discharge through home visit, pre-authorization audit and claims audit, rejected as well as approved claims. Moreover, the third-party administration TPA had also not conducted any beneficiary audit, post-discharge through telephone and home visits and pre-authorization of claim audit. 12. Ladakh. Neither the insurer submitted any report of audit, medical and other audits to SHA Ladakh, nor did SHA Ladakh frame any targets for conducting of sampled audit. 13. Madhya Pradesh. Shortfalls of 91, 71 and 76% was observed in conducting the hospital audit by ISA during 2018-19, 19-20 and 2021 respectively. 14 Maharashtra. Out of 3,381 medical audits, only 1,262 medical audits conducted. No other kind of audits conducted by SHA. 15 Manipur. SHA did not conduct any type of audit, and ISA did not conduct any death audit and beneficiary audit post discharge through home visit. 16 Meghalaya. Due to the non-formation of Claims Review Committee (CRC) and Mortality and Morbidity Review Committee (MMRC), claim audit approved and rejected, and death audits were not conducted. In respect of the medical audit, there was a shortfall of 91%, as only 146 medical audits against target of 1,644 medical audits were conducted by SHA. 17 Puducherry. No audit of any kind conducted in Union Territory. 18 Punjab. No audit conducted by SHA. 19 Rajasthan. Due to non-formation of CRC, any claim audit was not conducted by SHA. No separate MMRC formed, but it is a part of State Anti-Fraud Unit SAFU. Further, this records related the medical audits done by TPA and SHA not provided to audit. 20 Tirupura. Shortfall of 63.44% in death audit, 66.23% in medical audit, and 83.68% in claim audit was noticed. No other audit conducted by SHA. 21 Uttarakhand. Out of 5,884 death cases in 3 years, death audit of 750 cases has only been conducted, that is 12.75% against a target of 100%. Please like the video, subscribe to the channel. Please share it to your friends and relatives as information sharing. This will ensure the government implements these schemes properly against what we are paying as taxes. Thanks for watching.